Welcome to Mom in Mind, where we dive into all aspects of perinatal mental health and wellness related to pregnancy, birth, loss, postpartum, and new parenthood. It's so much more than postpartum depression. We raise the volume on all of these topics in the hopes that someday everyone will have the support and info that they deserve before they need it. Please note this podcast is not a replacement for treatment by a professional or professional training. The Mom in Mind podcast has been a passion project for me, absolutely, for the past 3 years. It's been an honor to go on this journey with you and have you be a part of the Mom in Mind community. In an effort to keep our podcast strong and growing, I've now set up a Patreon page for the Mom in Mind podcast. What's a Patreon? It's basically crowdfunding, a donation platform where you can help move this podcast forward so we can continue to get these awesome episodes out to you and all of the other moms and families who deserve to know that they are not alone. Contributions can range anywhere from $2 a month up to $25 a month, where you can become part of the Mom in Mind Collaborative, where as a professional, we can brainstorm together on how to get all of our voices for perinatal mental health out into the world. Come check it out at patreon.com/mominmind. We would love to have your support to keep this mission going strong. Welcome to Mom in Mind. I'm your host, Dr. Kat. In today's episode, we are talking with Dr. Venus Mahmoodi, who specializes in trauma and reproductive mental health. But very specifically, she's going to be telling us about perinatal mental health for Muslim women. More specifically, what rates of depression look like in the Muslim community in the U.S., what makes Muslim women particularly vulnerable to perinatal mood and anxiety disorders, and how can we support Muslim women in a culturally competent way. Dr. Mahmoodi completed her Ph.D. in clinical psychology at Palo Alto University in California with an emphasis in women's neuroscience and health through a collaboration with Stanford University. Her clinical training included working with refugees and torture survivors, veterans, and perinatal women in a specialized intensive outpatient program. Her dissertation focused on the perinatal experiences of Muslim women living in the United States, including the protective aspects of Islamic practice during and after pregnancy against depressive symptoms. She completed specialized training through Postpartum Support International and advanced specialized training in grief loss and distress related to infertility at the Seleni Institute in New York. She cares for individuals and couples at the Seleni Institute, which focuses on perinatal mental health, as well as the Haleel Center, which focuses on mental well-being of Muslims. So let's learn more from Dr. Mahmoodi. Welcome, Dr. Mahmoodi. Thank you so much for being with us.
Thank you for having me. I'm excited to be here.
I am excited as well, and really, really happy to be getting some information and education and your perspective as well on perinatal mental health for the Muslim community. I think this is such an important topic that not too many people get to hear about, but should hear about.
Absolutely.
Really, really important. So anywhere you feel like would be a good place to start for our kind of learning and education today?
Sure. One of the things that, I think is important is that, many folks, many clinicians and people in general are familiar with perinatal mood and anxiety disorders among the general population. And it's usually the number that we see in terms of rates of depression and like at clinical levels is around 20%. 1 in 7, kind of that statistic. And one of the things that I've noticed is that these percentages often increase in women of color, and that's not any different for Muslim women. When I was doing my dissertation study a couple of years ago, the rate of depression that I found in my sample was about 28% of women experience, anxiety or depression during the perinatal period at a clinical level. So that's quite high. And I think subclinical levels are above that. So it's a concern that is valid enough in this community where I think we need additional resources and support and help. But with any community of color, I think there's major concerns of stigma and, having adequate sources of support and reaching out to the community to make sure that they know that, these services are available. So I think that's the main issue with this population, that we see higher levels of perinatal mood and anxiety disorders, but in terms of support and help and reaching out to therapists, there seems to be a bit of a lag in making sure that those services are available.
Right, absolutely. But I'm assuming both just in general, culturally informed, but also specifically from a Muslim therapist. I'm wondering if the kind of numbers of Muslim therapists are also not high enough to meet the demand or the need?
Well, fortunately, that is something that's changing. There are more and more Muslim therapists that are interested in perinatal mental health. Yes, there are not quite as many as there's likely a demand for this type of service. I think there's only a handful of therapists that I know that are interested in this area who are Muslim practitioners. But also, for the community of therapists at large to be able to at least expose them to what the best practices are for this population, I think is also important. I have focused on teaching kind of Muslim mental health issues among various groups. So I went out to PSI a few years ago and did one of those talks on Muslim mental health and how that impacts the perinatal population. And there's quite a bit of interest in that. And also here in New York through the Mount Sinai hospital system, which is one of the largest hospital systems in the city. They actually requested, because they were having such a high number of Muslims coming through their hospital system, that they requested, what perinatal mood and anxiety disorders looks like within this population, and the incorporation of, the cultural and the religious understandings that come with this population. Because I think those are the most salient things. Like, how does the cultures, and, even though that's like, these are very broad perspectives, right? Like how the culture and how the religion play a role in this population. But it's been nice to be able to kind of go into communities and try to figure out how to help others become culturally competent within this area.
Right. I mean, I'm assuming and hoping that the demand continues and gets higher as people understand how important that cultural perspective is and the cultural and religious understanding is and how that, impacts everything. So how is it different? What are the particular vulnerabilities or challenges for Muslim women in the perinatal period?
Sure. That's a really good question. The first thing that I often kind of try to work through is what is deemed to be like ethnocultural issues, and then what comes up with respect to religion. A lot of times the two get conflated. So for example, like country of origin, people from different countries of origin are going to have the religion expressed in different ways. So specifically Muslim women who practice in one country are not necessarily going to practice in that same way in a different country. So I think that that's a very important point because, we kind of in the United States get, our patients are from various countries of origin. They practice Islam in very, very different ways. And so what might work for one person isn't necessarily going to be working for somebody else, and so on and so forth.
I was thinking too, maybe just kind of general population maybe doesn't have an understanding of how far wide reaching the Muslim religion is. And maybe I'm wondering how many assumptions are made that Muslims only come from the Middle East and how, I'm just interested too in just the lay perspective of that.
Sure, of course. I mean, the majority Muslim population countries go from, North Africa, parts of West Africa. So the largest population of Muslims usually comes from like South Asia. And generally when we see patients, predominantly from like South Asia, from like Eastern Asia, and not as many from like the Arab world, although that's what Islam is often associated with. Yeah. If we look at the Arab countries, they're often very diverse, and there's, very diverse set of religious backgrounds that you often see in like Arab countries. So there's definitely that difference.
Right. Thank you for broadening that. I'm just to kind of pull that perspective in as well, because I was thinking when you're talking about the cultural expression, there's such a range of cultural influence and how that plays out with, all of those factors.
Absolutely. And even within the religion, there's so much difference. You have, kind of the major two sects of Islam are the Sunni and the Shia. And so each one of those will have their own kind of sets of rules and expectations around, religious obligations, but also in terms of reproductive well-being and what that looks like and what the requirements are for women, during pregnancy and postpartum. And also, within each of those, there are a myriad of differences and various sects that go underneath the umbrella of those two kind of major sects.
Oh, sure.
Yeah. And there's often a lot of conflation that happens with what is culturally in terms of like ethnic background, like what expectations are around what a woman might do during pregnancy, what she might do postpartum, what the expectations are in terms of caring for their child, gender roles, all of that, and versus what is kind of outlined religiously in theology and kind of sacred texts. However, these are conflated often so much that it can actually lead to feeling some kind of depression or anxiety because it feels like religious obligations are not being met. So if I can give an example, one of the things that's outlined in the Quran is that a baby is to be breastfed for 2 years. This is not a requirement that's written in stone. It's not like you must breastfeed, children until they're 2 years old. However, that's the interpretation that's often taken. So a lot of times women will feel so much pressure to try to breastfeed because they think that if they go against this guideline, and essentially that's what it is, it's a guideline, then they feel like they're going against their religion. It creates a lot of anxiety and tension. And at the same time, we know breastfeeding in and of itself can be so challenging, so difficult, and can bring up a lot of mental health issues. Just the challenge of wanting to fulfill this obligation or this.
Yeah, as you were saying that, I was also kind of wondering about maybe family perspective or family pressure on also following the guidelines, and if that would also be stressful then too.
Yes, absolutely. So one of the things I did for my dissertation is ask this kind of open-ended question about what aspects of their kind of the participants' cultural backgrounds might influence their kind of well-being during pregnancy and postpartum, and looking at both, what are the challenging aspects of their kind of ethnic backgrounds and what are the kind of supportive and helpful things. And often what's helpful was like food, being given these very healthful foods, these strong, lots of like ginger and like these warm foods to help them throughout the pregnancy and also healing in postpartum. So a lot of warm foods that are very healing. And then when you hear about like the challenges, they were mostly around expectations that, the mother-in-law would come and help. And a lot of times relationships with mothers-in-law are strained. And there's this expectation that, okay, your mother-in-law is going to come and, quote unquote, help. But that also means that this woman who's in the postpartum period has to cook, has to clean, has to also try to take care of baby while she's trying to do all of this. And, it just kind of takes away that like, okay, this is her healing time and time for her to kind of get herself to a place where she's both physically and emotionally healing. But that's kind of taken away from her because, there's this other role that becomes dominant in that situation.
Sure. There's so many facets.
Yes,
like to cover both the religious and cultural and family dynamics that play out too.
Absolutely. One of the things that's pretty common among a lot of collectivist cultures is this like 40-day recuperation period. And I know that it's common amongst, both Mexican culture, Middle Eastern culture, Chinese culture. And it's something that's very common in the Muslim world. And this is definitely something that's not based in religion. It's based more on like countries of origin.
Sure.
And it's actually a very helpful practice where, the new mother is able to care for her baby and is able to be cared for by, all the women in her family. She's fed, like I mentioned before, like these very healthful foods and healing foods. She doesn't have to like cook or clean or, she can, just basically focus on trying to learn to breastfeed, trying to take care of herself, trying to take care of baby. And research has shown us that it is helpful in managing depression and bringing down, rates of depression in this population. However, it also depends on who is providing the support, who is helping. So if it's the mother-in-law, actually the rates of depression tend to increase. Whereas, isn't that something?
Yeah.
And however, if it's her own mother, it's actually a very healing experience where she really feels connected to not only like the women in her family, but also connected to the baby. Another aspect of this is that if the new mother is someone who's fairly acculturated and she doesn't really want to be doing, these kind of quote unquote old school techniques, that also can raise distress and anxiety and depression if she's kind of, forced into this kind of practice. So there's a wide range of how the same practice can be helpful for some and unhelpful for others.
Sure, absolutely. Yeah. Are there other religious-based things that might make this period a little more challenging?
Yes, one of the things that often comes up is around religious practice. So one of the things that my dissertation study found was that it was incredibly helpful for women to be praying throughout their pregnancy. And because the majority of women don't, have their menstrual cycle, their menstrual periods during their pregnancy, they're able to pray for the full, 9 to 10 months without having any kind of interruption. And what tends to be very challenging for a lot of women is that once they give birth, they go through this postnatal bleeding, which can last up to 40 days. And this can be very challenging for a lot of women who use prayer as a main source of coping and connection to God. And so, but I have to also clarify, so there are different types of religious practice that women and men as well can engage in throughout their lives, but there are certain ones where it is required for women and men to enter into a ritual state of purity. And when a woman is on her menstrual period, she's not able to enter that state of ritual purity, which prevents her from engaging in the ritual 5 daily prayers, as well as reciting Quran or touching the Quran. This does not mean that she's impure. This does not mean that that God is seeing her as other during that time. It is just that she's unable to enter that state of ritual purity because of the menstrual period. However, there are so many different ways of expressing, her religiosity and practicing the religion. But a lot of what happens is that a lot of Muslims see themselves as, a good Muslim is one that prays 5 times a day. And so if for this extended period of time, you're not able to do this ritual 5 daily prayer, it can be very jarring and very upsetting. And many women in my dissertation study actually expressed a lot of sadness and distress because they weren't able to express the religiosity in the way that they would have liked. So that was very difficult for a lot of women.
I guess I'm kind of reading between the lines a little bit, or maybe making an assumption that feelings of guilt or maybe even shame, how does that play out emotionally?
Yeah, I think there is a bit of guilt and shame. It certainly plays a role in, increasing distress, which can lead to increased feelings of depression, especially, we know with if there's a particular type of coping that works best with managing emotions and you're not able to engage in that coping strategy, right, it's certainly more challenging for them to try to find other ways. And often what I've done when I work clinically with this population is, okay, I know that you're not able to, engage in the 5 daily prayers, but are there other ways that you can worship God and you can feel connected? Are there other things that you can do? And trying to find other ways to connect with God. The thing is, a lot of the other ways of worshiping haven't been codified as much as the 5 daily prayers have. And it's something that's very specific to time and, what time of day. So, you wake up every morning at a particular time and you pray, and then there's one in the afternoon, one in the late afternoon, and then one right when, the sun goes down, and then one in the evening. And, it's something that's required. So it's very easy to do because that another prayer time is coming.
Sure.
Whereas the other types of worship might be, just kind of what is kind of more of a Western idea of prayers, where you just kind of ask God to help you with various things. This is kind of more open-ended, and you can kind of, the prayers are very basically, you can choose how you speak to God, what you say. It's really at your discretion. Or just, kind of contemplation, for example, is another one where you might look at, a tree and just be in awe of God's creation. So these are ones that a lot of us, especially those of us who were raised in Muslim majority households, parents who are immigrants from Muslim majority countries, we didn't grow up as these being kind of these really dominant and very important types of worship, because the 5 daily prayers were emphasized as being super important, more important than all the other types of worship. And so, not being able to pray is the worst thing in the world. And it just becomes this very challenging thing to reconcile with yourself that, no, it is good enough to engage in contemplation or reflection. It is good enough to just recite some verses that from memory. It is good enough to read a book that talks about, God's mercy or whatever it might be that is available to you. Yeah.
Right. And then the downside, like you said before, is that if people aren't remembering or something like that, that they have access to other ways to stay connected, that can contribute to the depression or anxiety.
Mm-hmm.
Yeah.
Yeah, absolutely. Absolutely. And I think that this is where a lot of the work, that I'm interested in comes in, because we often grow up being told that certain types of worship are better than other types of worship. And it becomes very challenging to convince yourself, for now, this is good enough. For now, this is a way that I can kind of connect with God. Because it's something that, a lot of times we're not used to, because we're used to kind of having things happen in a different way. So it requires a lot of support from the Muslim community. It requires a lot of support from scholars and bringing in like Islamic scholars, as well as mental health professionals who are able to say, no, there are so many different ways of worshiping God. It doesn't necessarily have to be in this particular way that you grew up being told is the best way.
We all want to do the right thing to keep our bodies healthy in the long run. Enter Ritual, the obsessively researched vitamin for women. 2 easy-to-take capsules provide the 9 nutrients you need to support a strong foundation for your health. I love taking the Ritual vitamin. It makes me feel really good to literally see, that I'm getting all of the nutrients I need to keep myself healthy. I don't know of any other vitamin on the market where you can actually see what you're about to take in. And I like that. The vitamin's transparent, and so is the company. You can look online and see exactly what you're taking. What's even better is Ritual is delivered. A subscription is easy to start and easy to snooze. It's only $1 a day to have all of the essential nutrients your body needs delivered every month, no strings attached. Better health doesn't happen overnight, and right now Ritual is offering my listeners 10% off your first 3 months. Fill in the gaps in your diet with Essential for Women, a small step that helps support a healthy foundation for your body. Visit ritual.com/momandmind to start Ritual today. That's 10% off during your first 3 months at ritual.com/momandmind. I wonder then too if there's kind of an added pressure, since the woman who's pregnant is carrying a child, then assuming also wanting to raise the child in the faith, and if there's an added pressure to be doing, what she's always done for the child, if that makes sense. Like during pregnancy and postpartum, if there's any particular challenge around, like, I have this new child and I want to be doing what I've always done religiously. And if they can't, I don't know. I'm just thinking out loud, wondering how it affects her feelings about being a mother to the child.
Sure. I mean, a lot of times there's pressure as a mother in general, because, the first place that a child will learn about their religion is at home with the mother. I mean, that's a lot of times what is assumed, and that's a lot of times what we're told, growing up, that, okay, the household is kind of the mother's domain. Mm-hmm. So those very traditional kind of gender role type of expectations. But again, this is another thing that's rooted in kind of the ethnic culture rather than the religion. Okay. And a lot of times, when I'm working with this population, I try to kind of help them learn, like, well, this is different. Like, the religion doesn't say that you must, teach your child like XYZ by a certain time. Mm-hmm. Yes, there are certain things that we want children to be exposed to as Muslims. We want them to be exposed to Quran. We want them to be exposed to seeing prayer and things like that. And so if a woman derives worth kind of being a mother through, okay, I want my child to see me praying 5 times a day. I want my child to see me reciting Quran. And I'm at a time of the month where I'm not able to do that, or I'm, then certainly that's going to bring up some guilt and some feeling that she's not adequate as a mother. However, this is kind of, like I mentioned, this is what a lot of the work is trying to figure out, how can we help this community understand, like, that there's so much diversity in the way that you can worship God. And one of the organizations that I'm working with, it's called the Haleel Center. And, we have various locations around the country. And one of the things that they're trying to incorporate is finding ways to not only bring in like the, psychological information and the theories and everything, but incorporating that with theology and religious thought, so that we can help treat someone both from the, psychological perspective, but also having enough Islamic knowledge so that we can kind of challenge some of these expectations of, I'm not going to be a good enough mother if I don't, worship in this particular way. Yeah, absolutely.
Yeah. And what are some other things you're seeing or found in your research that make this period challenging?
Sure. One of the things that often comes up is around gender roles. Often households that are traditional culturally, traditional religiously will engage in very traditional gender roles, no surprise. And often what happens is that not only are these new mothers kind of required to take care of this new baby, they'll be required to kind of take care of the household chores and, take care of everything like within the household. Husbands are often going out and working. But this is also, once again, it's rooted in kind of the ethnic, cultural kind of framework.
Sure.
Religiously, this is not necessarily a requirement. There's a lot of help is provided. So, if within the religious theology, if a woman would like support and help, and if it's within their means, she's entitled to receive help through like a housekeeper or, babysitting or things like that. And so this is something that often isn't seen as part of being religion. So often what happens is that when people see kind of these traditional gender roles, they associate it with the religion and that, Muslims, they engage in these traditional gender roles. However, both through my dissertation study and both through what the literature says at large, Muslim women often identify with more egalitarian gender roles. And a lot of households tend to be more traditional because of the, ethnic, cultural kind of systems that have come in place. So it's often problematic because this is how I was raised, this is kind of how things look. But when we look deeper into the religion, it can be very fluid, it can be very egalitarian, and, fathers will engage in helping a lot more than what we kind of assume and what, kind of the stigma is out there based on like, what Muslims tend to look like, which is also another issue, kind of perspectives of Islamophobia and kind of how Muslims are seen out in the world, I think really influence some of these issues that arise.
Right. Like the difference between the culture being from a Western perspective, I'll use terms that I've heard Western perspective people say is that using words like the women are oppressed, but what they're talking about is maybe the culture, but that's what you're saying, they're conflating it with the religion.
Absolutely. That's exactly right.
Okay.
A lot of these countries are very patriarchal. A lot of these countries put women in these situations that are horrendous. But, when I work with Muslims who follow the religion and, women who are deeply committed to the religion, they don't feel oppressed. They are not oppressed. They feel empowered. They feel that their religion gives them the ability to choose whatever lifestyle she would like. And also within the context of being a mother, there are so many rights that she has and so much support that she can receive. So I think the issue is when, a lot of the media assumptions are kind of, they can really distort what you're seeing in front of you. So even, in the therapeutic setting, that if these assumptions come into the session, they will certainly impact, the progress that's going to be made in session.
Oh my gosh, I can imagine, sadly, how many scenarios there might be from like a very Western-based perspective of psychotherapy and not taking cultural context, religious context into account, and the therapist having a very Western perspective and trying to apply kind of individualistic cultural perspective onto someone who comes from a collectivist Muslim country and religion. Oh gosh.
Yeah. Yes,
That's
definitely.
Sort of scary.
It is. And I think, it's important to remember that this is also a very resilient, very well-educated, very devoted group of people.
Absolutely.
Working with Muslims has been so amazing for me. Throughout my training, I didn't really focus working on Muslims. I worked with refugees and torture survivors for a year. That was the extent of, me working with Muslims. But this past year, I've been focusing predominantly on the Muslim population and have seen a vast number of perinatal cases as well. And, there's this resilience that I think is very beautiful to see, and their willingness to try therapy despite it being so new to the community and allowing themselves to be vulnerable in a space and speaking to a stranger. And I find that to be quite beautiful. And it's pretty amazing to be a witness to that.
Well, that's awesome. That's great. Can you speak more to the resilience and the strengths that you've seen from Muslim women in the perinatal period? Yeah, in particular, what are the strengths?
Yes. So essentially, these women, the majority of them come from collectivist cultures. So there is a very strong value on culture and being connected to family, being connected to a community. Their communities are very generous. The communities are very open-minded in terms of support and helping. These communities are fairly new to mental health, but they have begun to embrace mental health services and seeking support for mental health services. So I think that their willingness to try is really important. Religion can be incredibly protective. We have seen this in every tradition, every religious tradition, that religion can be protective against mental health distress and mental health issues. And it's no different in the perinatal population. In my dissertation study, we found, religiosity to be a protective factor in this population. And so definitely, I think their sense of connectedness to God and to something outside of themselves can be incredibly healing. And religious coping is often something that can help move them through these very challenging experiences. And that's also how Muslim women like to cope. They like to use religious coping to manage their distress and manage their symptoms. And we often will check in about how their prayers are going, what are they doing during their menstrual periods, checking in terms of like what their feelings are around gender roles. And, these conversations are often ongoing. And it's actually fascinating to kind of do a lot of couples therapy within this population because husbands are, want to be involved, dads want to be involved. So I think that, we have to be mindful of our assumptions of this population because they can be quite amazing to work with.
Right. And there are so many assumptions. I mean, I think specifically from again, taking a Western perspective, primarily Western perspective, the more you don't know about anything really, but a given population, the more assumptions you make. So having even this bit of education for somebody out there who doesn't have really any context for this is really very useful to just broaden our understanding so that we can come with more compassion. Yeah. I'm thinking specifically for therapists who may have Muslim clients, how can we be supporting them in a more culturally competent way, with more humility? Yeah, with more incorporating, like you said, the religion into the therapy.
Sure. I think it's important to be mindful of, the major vast differences between, different people from various countries of origin and how they practice. But I think it's also important to have a sense of, what are the basic tenets of Islam? What are the basics among all Muslims? Just so that, you have a sense of what's going on within this group. And then after that, be curious and ask your patients about, what their level of practice is. Even within, a Muslim mental health clinic, I see a wide range of religiosity. Some people are fully covered with hijab and others are not, but they're choosing a Muslim mental health clinic because their religion is a very important part of their identity. So if someone, who's coming to you, don't make assumptions. Be mindful of, okay, if they're wearing hijab, that doesn't mean that they're praying 5 times a day. Or if they're not wearing the hijab, they're not covering, that doesn't mean that they're not, very much attuned to their religious identity. Right. So I think approaching it from curiosity, but also, just having a basic sense of what does the religion say about worship? What does the religion say about women's dress? And, when a patient walks into your office, asking them what the role of religion is in their life.
Yeah. Thank you for that.
Yeah, of course.
Thank you so much for all of this. I'm really grateful to you for all of your knowledge and all of the work you put in on your dissertation and the speaking engagements you do. I think everyone should really hear what you have to say. And do you have any resources or last hopeful messages you'd like to leave us with?
Sure. First of all, I just want to extend my thanks to you for having me on. I think, this is an area that I'm very passionate about. And I think anyone who's interested in learning more about Muslims can certainly read this particular book. It's called Counseling Muslims, Handbook of Mental Health Issues and Interventions. It's not specific to the perinatal population, but at least it gives you a sense of, the Muslim population and mental health issues that arise within this population. It's edited by Samira Ahmed and Mona Amer. And also, I think that, the Muslim population is really a special population. For me, I think they're just like any group of, people of color. They're dynamic. They have a wide set of experiences, and there's certainly a lot of trauma within this population as well. So I would just approach them with curiosity and with compassion, just as you would with any other, population, vulnerable population. And, I'm really excited to continue doing this work. So I'm happy to, do more research so that I can, disseminate more of this information for everyone in the future.
Yeah, thank you. It's so needed. I appreciate the work that you do and the time that you took out of your day to share with us. Thank you.
Thank you. Appreciate it. You having me come on.
Thank you so much, Dr. Mahmoodi, for coming on and sharing this information with us. I'm encouraged by your work and the work you're doing to spread information and awareness for Muslim women so that we can learn more and be better supporters and advocate for Muslim women who are dealing with perinatal mental health issues. And for listeners today, please do share this episode. I think the more that we share this information and spread awareness, the better we can all be at supporting moms and families, and specifically Muslim women in the United States and around the world. Please find this episode and all of our episodes at momandmind.com. That's it for today. Until next time. Thank you so much for joining us today. Please share this podcast. Together we can support moms and families so that no one has to deal with this alone. Come connect with us at momandmind.com.